room is filled. Lots of people. I'm anxious to know where you're all from and what you want to learn about depression and how we can work together. I think that's one of the things that we're going to be trying to investigate today. As I told you, my name is Elizabeth Dixon. I'm the director of the Queen's Care Health and Faith Partnership. The group of nurses, we work out in the community with churches, schools, community-based organizations, and provide health services. So you'll learn more about our organization, and I hope to learn more about your organization. It's your organizations as well. Before we start the day, it's an auspicious day to have a community conference, and I think it's very important that we have a moment of silence for the nearly 3,000 people that lost their lives 8 years ago. Partners in Care, bringing health issues out into the community for the community's input on how to solve them and address them in the best way. So, as Loretta mentioned, this is a research project, and I hope that you've had a chance to read your informed consent and understand everything is voluntary, and we're happy you're here. You will learn whether you participate officially or not. All are welcome. And that's the way community conferences and community activities are done, both in my organization and in this project, is that we welcome your opinion, and you drive the process. You have the power to give the instruction and input to drive how activities and how problems in the community are addressed. So I got sidetracked. Ms. Loretta Jones. Loretta is the Executive Director of Healthy African American Families, and she is the community leader of this project in South Los Angeles. We are the Hollywood Metro group, and Loretta is in South Los Angeles. She has a long activity of working with the community, and it'll make me cry if I tell you how incredible I think she is. Just recently, Loretta was named by the NAACP as a Woman of the Year working for social justice in South Los Angeles. So the national organization of NAACP recognized all of Loretta's tireless efforts in working on behalf of the community. So this is a powerhouse, and this is a legend, and I'm so lucky to know her and to learn from her. So, and I'm glad that we can co-lead this effort in two different parts of town. We'll do it a little bit differently because the community dictates what we do. But we're very, very proud and happy to have such leaders of distinction with us.
Thank you.
Another leader of distinction is Dr. Ken Wells. Dr. Wells is a psychiatrist and a professor at UCLA and Rand. He is internationally recognized for his mental health work in communities. So he is one of the few, I will tell you as a community representative, he is one of the few academic professors I've ever met who listens to the community and lets the community drive the way interventions are directed, or he listens to the community. It's not perfunctory, oh yeah, okay, well, and do it his way. So Dr. Wells has a very strong record of working with the community in many areas around mental health, and if you Googled his name, you'd see about 1,000 entries. So he's written books, and the whole shebang. So we're very lucky not only to have a renowned community activist, we're lucky to have a renowned scientist, academic and medical scientist with us. So together we're all leaders in this project called Community Partners in Care. And as the slide said, it really takes a village to build a village for depression care. And that's what we're really trying to do. We're going to explain a lot more about the Community Partners in Care project, and Loretta and Ken are going to talk about what are the roots of the project, how did this start, and why do we think it's important. And then we're going to try and set a course for where we'll be going in the future. Before we get officially started with us talking at you, I want to let you know a few important details just of the day and kind of the agenda and expectations. So first off, if you haven't found them already, the restrooms are outside to your right, and they'll be available. Registration table is outside. Please sign in if you're looking for continuing education units or BBS units or all of that. You have to sign in and complete an evaluation at the end of the day. You will receive 5 free CEUs or BBS units, and we're happy to provide that for you. We have a little coffee and tea in the back, get it. Lunch is going to be at noon. Your attention is required at all times. Okay. The other expectation of the day is, as I've said, this is a community conference. So the expectation is that you talk, you give your opinion, that you participate. So, because without your participation, again, others will lead the project, or others will lead the project without the real input from the people who are on the front lines. All of you are on the front lines, coming across people with depression, and we need to know, together, we need to work on a plan to address our depression care needs in our community. We can't do it without the information from you. So we're going to have 2 open discussion times. So I really encourage you, if you want to get the most out of this conference, participate, and let's keep it lively. Maybe that's what distinguishes a community conference from a professional academic conference or something. But, anytime a hand goes up, you will be recognized. So everyone is important and brings something important to this conversation. That is a ground rule.